Sri Lanka is battling the worst outbreak of mosquito-borne dengue fever in years. Since January itself, more than 44,000 cases and at least 28 deaths, including that of 5 children, have been recorded. Needless to add, the massive outbreak has put the public hospitals under severe strain. Our next report gets you the details.
For a tropical country like Sri Lanka, the scourge of dengue, especially during the monsoon season, is not uncommon. This year, however, the situation is particularly bad. Out of more than 44,000 cases recorded, more than half the cases are from the western region of the country, including 9,429 from commercial capital Colombo. 8 other districts have reported more than 2,000 patients since the start of the year. The authorities pin the blame on the unplanned urbanization, coupled with damage caused by Cyclone Ditwa, which hit the island nation last November, for worsening the outbreak.
Sri Lanka is a tropical country. There are cases throughout the years, and we had a largest outbreak in 2017. Then after that, 2019, and there's a surge in 2023 also, but last year, the Ditwa cyclone, we see a higher number of cases than previously. For this year, our baseline was high in January also. So due to this weather pattern, in intermittent raining pattern, and a higher number of waste in environment may have caused this outbreak.
According to the data from the National Dengue Control Unit, the number of dengue cases nearly doubled from 5,651 in April to 10,638 in the first 2 weeks of June. Worse, the infections are likely to increase for at least 2 more weeks before tapering off toward the end of this month. Schools, government institutions, factories, and religious places have been identified in surveys as the places most likely to have a lot of mosquito breeding places. To put things into perspective, last year, 51,000 cases were recorded, but the rate of infections has risen sharply this year. Given the gravity of the situation, the authorities have warned that the patient numbers for this year could end up matching the last major outbreak in 2019, when Sri Lanka recorded over 105,000 dengue patients. On the 19th of June, Sri Lanka's Health Minister, Nalinda Jayatissa, had warned that a further uptick in patient numbers could put public hospitals under severe strain. In a bid to control the deteriorating situation, health authorities launched a special program under which schools, homes, construction sites, and public buildings were being cleaned up. With more than 1,000 admissions a day, hospitals are clearly overwhelmed, prompting the deployment of military to contain the spread of mosquito-borne dengue fever. The question is, how swiftly can the island nation bring the scourge of dengue under control?